Hello, my name is Jerry Monaco. Today's presentation examines if the functional movement screen, or the FMS, can predict injuries with athletes. So, what is the FMS? It is an observational assessment of basic functional movement and examines and grades movement patterns in a qualitative manner. The FMS is comprised of 7 individual movement patterns. These movement patterns consist of shoulder mobility, trunk stability, push-up, deep squat, hurdle step, inline lunge, active straight leg raise, and rotary stability or bird dog. The FMS is scored on an ordinal scale from 3 being the highest to 0 being the lowest. The scores are based on the degree of compensation or asymmetrical movement. The max scoring of the FMS is 21, which means the individual has no to minimum compensatory or asymmetrical movements. However, if the score is 14 or below, also known as the cutoff score, the individual can be at risk for injury. There were 2 studies that examined this with female collegiate athletes and football players. So what's the reliability of the FMS? Systematic review studies have demonstrated overall good inter- and intra-related reliability. However, there was conflicting results where one study showed no difference between clinician experience, where another review study showed clinicians who were more experienced with the FMS demonstrated higher reliability than those with less experience with the FMS. Which brings us to the case, is the FMS valid? When Gary Cook designed the FMS, one of the purposes of it was to use the scoring as a predictor of future injury. However, I always felt that just because we observe compensatory motion, does that mean there is an injury? So what does the recent literature say about the validity of the FMS? Bonanza's systematic review and meta-analysis demonstrated flaws in both internal and external validity of the FMS. Phillips' systematic review concluded that the FMS does not demonstrate the properties essential to be considered as a measurement scale and has neither measurement nor predictive validity. Whiteside evaluated the criterion validity with motion analysis and found low correlation between the observational grading of the FMS. Warren's review study found the FMS has low sensitivity for risk injury. Usually, screens have higher sensitivity to rule out certain pathologies, but having low sensitivity can give the assessor a higher false positive rate. So, is the FMS a valid predictor of injury? Well, based off the current evidence, it is difficult to support the FMS as a predictor of future injury. But let's take a look at the studies that evaluated the FMS as an injury predictor. They found conflicting and inconsistent evidence when evaluating the FMS scores and their relation to injury prediction. Some studies involved a variety of sports showed that correlation between lower scores and future injury, where others did not. However, some studies showed that despite the overall score, the individual components of the FMS were a more valuable predictor of injury, especially if the scores were less than 1. However, one study looked at previous injury when evaluated that had a low composite score, less than 14. This indicated a better predictor of injury. I believe that future studies that evaluate the validity of the FMS should take that into consideration to make it a more valuable assessment tool to predict future injury. So why do we have conflicting evidence? Well, there was much variability in majority of the studies' methodology. We do know that all sports require different demands and can the components of the FMS correlate to these demands? But that's difficult to fix. However, there was broad definition of a injury description within majority of the studies. All the studies reviewed were low to moderate quality or were level 2 to 3 studies which did not have a comparison. A majority of studies did not factor in the individual plane or practice time after the FMS evaluation, which is considered a true confounder within the studies. I have concluded that rehab and strength and conditioning specialists should use caution when using this tool as an injury predictor due to the conflicting evidence and the variabilities in the study's designs when evaluating the purpose of the FMS. The FMS is more of an assessment of quality of function movement and can help both rehab and strength and conditioning specialists prescribe appropriate interventions to restore efficient movement patterns. Future recommendations should further evaluate the individual components of the FMS rather than the total scores as predictors of injuries, and evaluate athletes with previous injuries and examine their scores and injury risk due to non-injured athletes' scores injury risk with the FMS. Please comment if you have ever used the FMS. I'd like to hear your opinions on it. If not, thank you and have a happy holiday.